A video has recently surfaced showing pregnant women sleeping on the floor at Rahima Moosa Mother and Child Hospital. Since then, the National Freedom Party says if President Cyril Ramaphosa and his cabinet use public health facilities, issues like what we've seen would be attended to urgently. Let's get you a sense of what the way forward ought to look like. Bring in SAMA chairperson Dr. Mvuyisi Mzukwa, also the NFP Secretary General Canaan Mdletshe. Both our guests joining us via our video link this morning. Before that, though, this issue was brought forward by the Health MMC, or the MMC for Health and Social Development in the city of Johannesburg. That's Ashley Souls. We spoke to Ashley here on Newzroom Afrika. Take a listen to what he says is the reason behind what we saw take place at that institution.
And you are right. There should be more decisive action to ensure that South African citizens are put first and that they are served in the best way possible. But currently, that is not the case. But as an MMC of Health, I'm saying that the time for putting blame on this one or that one is over. We need to start coming together on all levels of government, local, provincial, and national. Put our heads together. Be decisive. Look at the problem and stop tiptoeing around it and realize that the issue is illegal immigration. It's putting pressure on our health systems, and it is negatively affecting South African citizens. So let's stop making excuses. Let's stop running away. Let's firstly apologize to South African citizens and say, we are going to make this right. I'm ready to do so in the city of Johannesburg.
The MMC, they're essentially saying that this is due to illegal immigration. Dr. Mzukwa, I'm sure you heard that. Do you agree?
Good morning to you and to your viewers and to my fellow panelists there. I wouldn't really agree with the MMC because, look, we understand that if there's any issues with demand in the healthcare system, we know that we should improve our infrastructure and our human resources as well, so that those are able to support, the incoming demand. We cannot, especially with us as clinicians, we don't even ask where you're coming from. All we do is provide a service in front of us. We're not Home Affairs officials, but I do think that government needs to up their game. If there's a problem, we have always advised government that they need to negotiate with SADC and, everyone is involved around to sort out the problem of influx into the country.
Right, looks like our connection to Dr. Mzukwa there isn't the greatest. Hopefully it'll stabilize in just a moment. Whilst we work on that, let me bring you in, Canaan. You have released a statement as the NFP, essentially calling on President Cyril Ramaphosa and the cabinet to use public healthcare facilities with the hopes that this will lead to these kind of problems being attended to urgently. The cynics among us may say that's unlikely to happen. So in the interim, from your vantage point, what do the solutions look like in order to solve our immediate crisis?
Good morning, Ayanda, and the viewers at home, as well as Dr. Mzukwa. Yes, Ayanda, it's quite depressing to see what is happening in our hospitals, in our public healthcare facilities. But as impossible as it might be, the reality is, as soon as we accept that this is a national disaster, we need our government, we need the head of state to lead by example and be the first one actually, to say, as from now on, I'm going to use public health facilities in order for them to improve. I think that's the only solution. I know it's impossible, but it's doable. If the president is really serious about tackling this matter, he should do it, and his entire cabinet. Because the reality of the situation is, if you go to public hospitals in the country, they are in a mess. They're in a state of collapse. And we've been in government for almost 28 years, but no changes. Therefore, we need to do drastic interventions, including our cabinet actually taking a lead in this situation.
Yeah, there is a point there. I mean, Dr. Mzukwa, if you go to any public healthcare facility, especially in Gauteng, you really are spoiled for choice about which of the issues to highlight. In fact, you were on this very program just last week speaking about a different issue at Helen Joseph Hospital, where psychiatric patients, we're told, had to camp on corridors for days before they received any kind of assistance. Interestingly enough, the CEO at Rahima Moosa Mother and Child Hospital says the reason, or at least part of the reason why heavily pregnant women are sleeping on the floor is because infrastructural development hasn't kept up with demand. I mean, again, from your vantage point as a medical officer who's worked in the space, is that a justifiable reason for why these women would be found sleeping on the floor?
No, and there is no justifiable reason whatsoever. We need to understand whether the institution is giving the right information to the province, so that the province will beef up resources in the institution. We need to understand if the province is doing enough. We know that what they're doing at the moment is to freeze posts and making sure that there is no reasonable delivery of services. So this is what we are going to see. But I understand the most crucial thing is that patients must not be involved in these poor management decisions that people are making. The healthcare system must provide a dignified service, taking the interest and the values of patients into consideration. You cannot allow people to be lying on the floor like that, and there is no justifiable reason whatsoever. And we need people to understand that, if you keep doing that, what we see in the media, it is going to affect government, because what happens is that you have litigation going up. You know that provinces cannot cope with litigation issues. And if you continue to have those pictures that we see, I am telling you, are going to be living in a vicious cycle where we pay litigation, we don't have money to up the services in the public sector.
Yeah. Surely institutions like Rahima Moosa have some kind of quality assurance unit, Dr. Mzukwa. I mean, what role would that kind of body have? And perhaps I'm not even using the right terminology, but I'm sure you understand what I mean. Some kind of institution within the hospital itself that is responsible for looking at things like whether or not the service you're providing is adequate at the very least.
It's well and good to have those, agencies inside the hospitals, where they making sure that, the service is of good quality. But some of them exist on paper. They're not there. They are not capacitated. There's no human resource. So it's just you having that on paper. It's not helping anyone. I mean, if there was that institution, within the hospital, you would understand what would happen there. But it's not happening. There's no one. There's no accountability. And the CEO must take responsibility in that regard.
Yeah. In fact, that's the question I was hoping to pose to you, Babu Mdletshe. I mean, at the very least, we'd hope that there'll be some kind of accountability. Typically, what happens is that there's outrage, there's calls for resignations, perhaps there's some kind of response from government. In fact, we're told that the health MEC, Dr. Nomathemba Mkhithi, is going to visit the institution today. But none of that actually solves the systemic issues that we're seeing. How do we address that?
Quite correctly, I agree. I totally agree with Dr. Mzukwa that having all these systems in place is not going to assist us. And yes, I agree also with the calls of people to take accountability. People must be fired for failing to do their work. But that is not enough. I think our government need to sit down, and I think all of us need to get involved in this one, because it affects each and everyone amongst us. We need to sit down and devise a plan, a strategy on how we're going to work this thing out, because pointing fingers is not going to assist, and firing people is not going to assist as well. I think it's deeper than that. The infrastructure has collapsed in many institutions, and we need to actually do more. We need to have all hands in deck to try and sort out this mess. Otherwise, people are going to die. In fact, if you look at the statistics, the number of people who go into our hospitals don't come back, they come out as corpses. And because of the infrastructure, because of lack of leadership in the institutions, but over and above that, we definitely need to do something. Our government need to work on this. They need to put up some money, and we need to hire capable and competent individuals to lead the hospitals in our country, because you will find in most instances that the people who are leading were just cadre deployed. They were not. They are not qualified to be the CEOs, to be the superintendents of the hospital. Most of them, yes, they do have the degrees, but you'll find that they are not have enough experience to lead such crucial institutions in the country. Therefore, we need all of us to work together and try to find a lasting solution.
Sure. Another week, another crisis to attend to in Gauteng Health. Gentlemen, thanks very much indeed for weighing in on where you think the problems lie. Hopefully the solutions will be forthcoming sooner than later. Dr. Mvuyisi Mzukwa is the chairperson of the South African Medical Association. Also joining us there is the Secretary General of the NFP, Canaan Mdletshe. To both of you once again, thanks very much indeed.